So I'm now joined by Professor Iain Buchan, Director of the Health eResearch Centre. Hi Iain.
Hi Amanda.
So can you tell me why health eResearch is so important?
Health eResearch is vital. Most people don't know, but if they go and see their doctor, a total of medical knowledge predicts about a third of what's going to happen to them if given a particular treatment. So 2/3 of healthcare is a natural experiment. And we live in a digital revolution where a lot of data is collected on everyday healthcare. That means there's a lot to know by looking deep into the data at what happens to people as they journey through healthcare.
Well, that's really interesting. Could you give me some examples of where your research has benefited the public?
I'll give you two examples. The public benefit indirectly through plugging big gaps in medical knowledge, and directly through becoming more hands-on in eResearch ways with the science and engineering of eResearch. So the discovery side first. We took 6 lots of children growing up. There's a classical study method called a birth cohort where you follow people and look for why some people develop diseases and other people don't. And we were looking at asthma as children growing up. It's normal for scientists to work on one of these big studies, but in an eResearch way, working together with more data is important. More brains and more data working together. So 6 groups came together and they took something which was questionable, but is out there as an assumed fact, which is called the atopic march, which means if you get skin allergy, it was presumed through the biology that you'd then be more likely to get lung allergy and asthma, and then a runny nose, rhinitis. When we looked really hard at the data, did some very complicated modelling with a lot of data, and a lot of people thought carefully about the problem, it was found that less than 5% of children actually show that pattern of atopic march. So we bust a myth. And there should be some new targets in there coming out of that research for thinking about preventing asthma. Now the hands-on eResearch, where engineers, scientists, statisticians, clinical researchers come together to measure things about people's health. We took a really important problem, which is schizophrenia, which is a miserable condition when it gets worse, because people sometimes go off the medicines and they need to take more control over their own symptoms. So instead of doctors measuring things in hospitals, we gave those tools to patients on a mobile phone, developed the tools to fit on the mobile phone by working directly with patients. So there's some really hard science in how you measure mental health through mobile phone applications. Something goes ping at certain times in the day, and you respond not to a paper questionnaire with 20 questions, but to 2 or 3 questions, but they're asked more frequently. By doing this, we're finding out new things about why people relapse in schizophrenia, and we're more likely to prevent that.
Well, that sounds fascinating. So what's next for the Health eResearch Centre?
Next is scaling up. We have a tsunami of data. If we work in conventional ways, there's a blizzard of different papers that can come out of analysing the data, but we're trying to make work smarter with bigger teams where more disciplines come together. For example, a mathematician, statistician will work alongside a software engineer, alongside a general practitioner, looking at new ways to feed back important information to continuously improve services. We're going to increase the numbers of people through training, through addressing more research challenges, and on a bigger scale, working with other centres like this one throughout the country.
So there's a lot of public involvement in your research. Why do people want to be involved?
I'm sure we all have experiences of healthcare and the care of our loved ones, which gives us motivations, wanting medical knowledge to be better. From my own experience, both of my parents had pulmonary fibrosis and have sadly passed away, a condition for which very little is known about the causes, and treatments are best guess. But there's a lot of data out there on what happens to people with this relatively unusual condition. By pulling the data together, much more could be known, and the future could be better than it was for my own parents. When we talk with patient and public involvement groups about their experiences, they come up with very similar heartfelt stories. And we're still listening to those, and it motivates a lot of our research.
Well, thank you, Iain.
Pleasure.